I mean, we've effectively killed the golden goose in South Africa. There isn't our middle class is severely constrained, and just pushing more additional taxes on our middle class will completely destroy it.
What is the current state of healthcare in South Africa in both the public and private healthcare sectors? Well, we at the Centre for Risk Analysis have just released our latest macro review. You can access this on our website. We'll link to it in the description below. And in our macro review, we unpack the state of healthcare in South Africa through a range of data analysis and commentary on some of the main policies in the healthcare sector. Joining me to unpack our report is one of the co-authors of our macro review. He is also the editor and deputy head of research at the Centre for Risk Analysis, Gerbrandt van Heerden. Harry, thanks very much for being with me today. Let's start off with just we've got a few questions in the report. There's a lot of data to analyze, but I thought we'd narrow it down on a few essential items. We're going to start maybe with South Africa's healthcare expenditure and what you and your fellow co-author Tawanda found in terms of your research. So looking at South Africa's healthcare expenditure as a proportion of GDP, what can you tell us about that?
Well, I think I'll first start off by saying that there's this perception or notion that there isn't enough funds in the healthcare sector, and that in order to adequately address the issues that are plaguing our hospitals and our clinics, we need more funding. But what we found is that throwing more money at the public healthcare sector isn't going to effectively address those issues. In fact, when we compare South Africa to emerging market to the country's emerging market peers, we saw that South Africa is actually spending an adequate amount on healthcare. So healthcare expenditure as a proportion to GDP was far higher in South Africa than in China or in Russia. And it was equivalent to countries such as Finland and Spain, more advanced countries. And yet all of these countries that I mentioned have better clinical outcomes than South Africa. So the idea here is that throwing more money at the problem isn't going to solve it. And the Institute of Race Relations a few years ago looked at a number of media reports which looked at the state of public hospitals across the country. And what they found there was that many public hospitals are plagued by mismanagement, by negligence, corruption. These aren't problems that you can solve with money. These are problems that you have to solve with accountability, with proper appointments based on merit, and successfully clamping down on corruption.
Harry, I think it's important there to highlight this idea of just spending that will fix all problems. So we've got the proposal of the National Health Insurance. In a nutshell, it would centralize and monopolize the management of all healthcare in the hands of the Department of Health in the form of an NHI fund. The Minister of Health would be central in appointing people on the NHI fund board. But even presuming you've got the best minister and the best, enlightened, noble individuals, there's no guarantee that they would adequately spend that much money that would be in a sort of NHI fund, ideally speaking. In terms of your research, what are we looking at in terms of funding an NHI, sort of any costing estimates, presuming that sort of money could be found, even at this point in time where you look at South Africa's GDP growth being radically pared back? I think the IMF just yesterday or today published their latest projections for this year, and they project South African GDP to grow only at 0.1% for 2023.
Yes, so there was an impact study that was done in 2019, and the figure that they came up with for us to be able to afford the NHI was around 250 to 300 billion rand. But that was 2019. That's obviously an outdated figure. More recent figure that was provided by a private medical scheme pegged the figure closer to 500 billion, but there's still a lot of questions around what the NHI will really cost. And even the Department of Health has been shying away at really giving us a proper figure. And that's very concerning, the fact that the Department of Health and government can't really say where the money is going to come from and how much we're going to need. And you also touched on the issue about the fact that our economy isn't growing. And when your economy isn't growing, that means people are not getting jobs. That means the country's not generating taxpayers. And in fact, we're actually losing taxpayers. The New World Wealth have, every year, they in their annual report, the New World Wealth estimates hundreds and hundreds of high net worth individuals packing up their bags and leaving South Africa permanently. And these are people who are, I mean, they're necessary to fund expensive systems such as the NHI. So unfortunately, with a low growth environment, with accelerating immigration of skilled individuals, high net worth individuals, our tax base is extremely constrained. And the government has stated that they propose to fund the NHI through additional taxes, such as a payroll tax. But I mean, we've effectively killed the golden goose in South Africa. There isn't, our middle class is severely constrained, and just pushing more additional taxes on our middle class will completely destroy it.
Carrie, just a final question in terms of possible ways out. It's too easy for me to ask you to fix everything that ails healthcare in South Africa. I won't put that particular burden on you, but for yourself and Tawanda, in terms of your research for this particular report of ours, are there 3 to 5 priorities that you would advise in reforming healthcare in South Africa? I mean, the big one is don't try and implement the NHI, but in terms of sort of positive changes that could be done, what do you think of that?
So South Africa has a very well-performing private healthcare sector. And that's a good thing because our private healthcare sector relieves some of the burden on the public healthcare sector. So what we're essentially saying is that the NHI or the government should let the private sector be. Don't try to take control of it, centralize it, nationalize it. Allow people to be able to choose what type of care they would like to get. And this as I've said, the private healthcare sector relieves some of the burden on the public healthcare sector. And as I mentioned earlier in the video, what we need to do is effectively address the management crisis at the public healthcare sector. And you can only do that through merit-based appointments and severely clamping down on corruption and enforcing accountability. Those are the types of steps that you need to take, because we've already seen that state-owned entities such as Eskom and the South African Airways, Transnet, the education system, the public education system, all of those have been run into the ground, essentially. And the idea that if the state takes control of the private healthcare system, that will magically solve all of the country's healthcare problems. Um, that belief is misplaced. We should leave the private healthcare sector alone and get to the fundamental core issues that is plaguing the public healthcare sector.
Thank you very much for watching. To get full access to this latest macro review, as well as all of our other reports and research, please go to our website and consider becoming a client of the Center for Risk Analysis. Until next time, this has been Chris Hattingh, Head of Policy Analysis at the CRA. Take care.